it for a while, but I think the most of the country is not going to know that this exists. This idea that there's a whole a whole cadre of hospitals that will sue working class patients for medical bills that are unpaid. Now, here's the thing. If I don't pay my mechanic, I expect him to sue me to get that money back. That makes sense because it's a fair price for services rendered and I didn't pay. The problem with medical bills is it is not a transparent, competitive, or a fair price. It is a price gouging markup over what Medicare would pay because hospitals can do it. They say, well, nobody pays the marked up prices because people have insurance, except when they have high deductible plans or they're uninsured. And so what do these hospitals do? Often the CEO doesn't even know what's happening. They're suing their own patients. Can you talk a little bit about that? Because that made me so furious as a physician to see that we're hurting our own patients.
Yeah, and first of all, if your hospital or your practice charges 2 or 3 times the Medicare allowable amount, then okay, maybe that's a reasonable, fair price. We're not saying everyone should accept Medicare prices, but right now it's the Wild West. If you charge 5, 10, or our research even shows 23 times the Medicare allowable amount. In a study we did of emergency room service, emergency department services, and oncology services, 2 papers. We got hammered by the journals. Nobody wanted them. We finally got them published in JAMA Internal Medicine and another journal. And these 2 articles, they forced us to change the language. They sterilized us. They took out all of our passion in the article. They did what medicine does to its own creative people. And we pointed out a 23 times markup is egregious. A researcher published what I consider to be the article of the decade. No one noticed this study, but I noticed it. A cardiac surgeon called 100 heart hospitals in the United States and says, how much does it cost for a cabbage? He fought and went through the voice menu, and they transferred him and hung up on him, and he called back. And in the end, 51 out of the 100 so hospitals could give him a price. The price ranged from $44,000 to $450,000. He then matched the price with the STS outcome database, which is, as you know, the most mature public quality reporting database in medicine, and found no correlation whatsoever.